When a child is born, either through vaginal delivery or cesarean section, the level of progesterone and estrogen drops rapidly. Prolactin is no longer blocked, hence lactation begins. The pathophysiology of breast milk. Oxytocin is released by the posterior pituitary gland. Oxytocin further stimulates myoepithelial cells in the breast. The myoepithelial cells stimulate the alveoli to start filling up with breast milk. So babies and mothers start bonding. So today on Morning Talk with Falakemi, I will be talking about mastitis. What is mastitis? How can we prevent and treat mastitis? Yes, but before I go on, I would like to also remind you that prevention of breast cancer starts with you. Monthly breast self-check, annual breast examination, mammogram, ultrasound of the breast together helps in early detection and treatment of breast cancer. Today with me, I have the sagittal section of the human breast. This is a model. It's not real. It's just a model. So right here, I have the rib. The white patch is the rib. We have the pectoralis muscle. That is the muscles of the breast. It's called the pectoralis major muscle. We have adipose tissue. All those yellow things are called the adipose tissue. We have the mammary gland. We have the sinus lactiferous, and we have the lactiferous duct. That's just like the anatomy section of the breast. So what is mastitis? Mastitis in a simple form is just inflammation of the breast tissue, what are the causes? The causes of mastitis is majorly infection for a non-breastfeeding mother. When there's a crack in the nipple or where there's an open area in your breast, bacteria can invade, causing an inflammation of the breasts. But for lactating mothers, it's called the lactation mastitis. That could also occur as a result of an infection when there's a crack on your nipple or there's an open area in your nipple. Infection can happen as a result of bacteria invading into your breasts. Another cause of lactation mastitis is inability of the mammary duct emptying the breast milk. So engorgement starts, and if the baby is not sucking that particular breast very well, it can lead to an inflammation. Once there's an inflammation, infection begins, right? So what are the signs and symptoms of mastitis in a breastfeeding mother? Number one, it's going to be warm, tender, red, painful, a kind of flu-like symptoms that can cause you to have a little bit of a rundown, and then your temperature will go up more than 36.7. It can start from like 38.2 and above. So what can you do when this starts? There are some home remedies you can do to prevent this, and if that doesn't work, you just have to go and see your doctor. Home remedies that you can do to prevent mastitis is: number one, make sure your baby latches on very well. Make sure you are breastfeeding your baby on a particular breast at a time. Don't do it at the same time. Like, make sure your baby breastfeed very well on that particular breast before you move the baby to the other part of your breasts. And then when you notice that warmness and redness, don't stop. Don't make that mistake of stop breastfeeding your baby, because if you stop breastfeeding your baby, the engorgement continues and it can be very, very painful. So continue to breastfeed your baby, then see your doctor. Your doctor will most likely prescribe you antibiotics for maybe 7 to 10 days. And if that does not stop, you have to also reach out to your doctor, because there's something called IBS. It's called inflammatory breast cancer. It can mimic signs and symptoms of mastitis. And what is inflammatory breast cancer? Is a rare type of breast cancer that is aggressive in nature, and it kind of mimics the signs and symptoms of mastitis. So after 7 to 10 days that your mastitis is not improving or is not going, you have to reach out to your doctor to let them know that the antibiotics is not working. Then your doctor can further do tests. Is that they take a sample, or or they tell you to go and do mammogram or ultrasound. Okay, so let's get back to what we're talking about. So make sure your baby continue to breastfeed on that particular breast very well. That doesn't mean you will abandon the other breast. You still have to continue to be breastfeeding your baby on both breasts at the same time, I mean simultaneously. Then what other home remedy can you do to prevent mastitis? So when you notice that your baby is sucking on the other side of the breast, you can get a warm cloth, just put it on that breast, you know, while the baby is breastfeeding. Another thing you can do to prevent mastitis is to make sure you don't wear tight bra. Yes, make sure when you're breastfeeding your baby, even when you're not breastfeeding, make sure that your bra is fit enough, not very, very tight, because that can lead to mastitis. Another thing you can do to prevent mastitis is hygiene. Make sure you're neat when you're breastfeeding your baby. Make sure your nipple is clean, because when you have a lot of breasts in that area that you're not washing properly, that could lead to an infection, you know. So personal hygiene, you have to improve on your personal hygiene. So what are the treatments? Like I mentioned, treatment is antibiotics. Your doctor prescribe you antibiotics. You take your antibiotics between 7 to 10 days, and if there's no improvement, please make sure you reach out to your doctor that your antibiotics is not working. Sometimes they just take a sample, run it through the lab to make sure you are taking the proper antibiotics at that time, because if it's as a result of an infection, they want to make sure that they are prescribing the appropriate antibiotics for the particular bacteria that was cultured. And another thing that they do as part of the treatment is if there's an abscess, because with time, if that is not working, it can lead to collection of pores, which is abscess. Your doctor can go in, that's when they come in surgically, either to do a fine needle aspiration or to cut the place open a little bit with a little bit of nip, and then they drain the abscess and still place you on antibiotics. So please don't be afraid when you have any signs and symptoms of mastitis. Reach out to your doctor, do your own remedy, make sure your baby latches on properly, and then when you are pregnant, before you give birth, I think it's about 8 to 9 months, you have to register yourself into lactation clinic so that you can see your lactation specialist. Your lactation specialist would put you through on how to properly breastfeed your baby, on how to make sure your baby latches on properly, so that you don't have issues with breastfeeding, especially for new mothers. Okay, thank you for joining us today on Morning Talk with Folakemi. And before you go, please don't forget to like my videos, share my videos, and don't forget to click the notification bell. And you can also suggest any topic you want me to talk about. Thank you today, and I will see you some other time. Again, Happy New Year, and I wish you a prosperous one. Bye.